Hi everyone! In this video, we're going to discuss how to take care of patients with carbon monoxide poisoning. Always an important topic to bring awareness to. So let's get started. So first, let's talk about what carbon monoxide is. Carbon monoxide is a tasteless, colorless, odorless gas produced by burning organic compounds. It's found in smoke from fires, cigarettes, and exhaust fumes. And exhaust fumes are pretty much waste material released by things like portable heaters, stoves, and engines, just to name a few. Carbon monoxide can cause severe organ damage in a very short period of time. More than 150 people die in the United States each year from non-fire related accidental carbon monoxide poisoning. Now we're going to walk through the pathophysiology of carbon monoxide poisoning. Carbon monoxide becomes poisonous as it builds up in the bloodstream. When carbon monoxide is inhaled, it binds to hemoglobin. Together, carbon monoxide and hemoglobin will form a compound called carboxyhemoglobin. Now, we know that hemoglobin carries oxygen, right? But carbon monoxide is going to occupy that space that oxygen would normally be carried. So, as carbon monoxide occupies space in some of hemoglobin's oxygen-carrying spots, hemoglobin is going to change its shape. This is going to cause hemoglobin to bind with oxygen more frequently and more strongly. Hemoglobin's grip on oxygen will be so tight that it prevents oxygen from being released throughout the body. So oxygen and hemoglobin kind of form like this toxic bond with one another. So at this point, carbon monoxide is being circulated and delivered to bodily tissues instead of oxygen. Now, carbon monoxide is more likely to bind to hemoglobin than oxygen is. So even the smallest amount of carbon monoxide can still be harmful. Carbon monoxide poisoning can result in mild symptoms or progress to a life-threatening problem with long-term effects. Symptoms include but are not limited to confusion, dizziness, tiredness, nausea, vomiting, dull headache, shortness of breath, and in severe cases, seizures, coma, or death. Okay, so let's discuss nursing assessment. When you assess a patient with carbon monoxide poisoning, you may find that he or she has tachycardia, hyper or hypotension, hyperthermia, erythema. This may manifest as cherry red lips on darker skinned patients. You may also find that your patient has pale skin, impaired judgment, papilledema, which is swelling of the optic nerve, ataxia, which is the inability to move, emotional lability or mood swings, brisk reflexes, which are extremely fast reflexes, arrhythmia, which is improper beating of the heart, and as we just stated, in severe cases, the patient may have seizures or go into a coma. Let's discuss some ways carbon monoxide poisoning is managed medically. Medical treatment includes 100% oxygen delivered at atmospheric or hyperbaric pressure, supportive care, of course respiratory support. This could require endotracheal intubation or mechanical ventilation for the patient, and if needed, IV would be administered to restore intravascular volume. Okay, so now the fun part. Let's discuss some interventions we can take as the nurse to care for a patient with carbon monoxide poisoning. As you guys probably guess, we should auscultate lung sounds every 1 to 3 hours. And when we auscultate the lungs, we want to listen out for crackles or wheezing. The presence of crackles or wheezing could indicate a change in the patient's respiratory status. We should monitor respiratory rate, depth, and effort. We also want to monitor this patient's blood gas values, as well as pulse oxygen saturation levels. And remember we said that patients with carbon monoxide poisoning don't have an adequate amount of oxygen circulating the bloodstream. So we're also going to want to monitor for manifestations of hypoxia, such as mental changes, restlessness, agitation, and confusion. A patient with hypoxia may also have changes in skin color and use their accessory muscles to breathe. Elevating the head of the patient's bed to 45 degrees is an intervention that can enhance oxygenation and increase expansion of the lungs. We could also put the patient on a 2-hour turn schedule or get them a bed that does it for us. This can prevent complications that come from immobility. It can also decrease the risk of atelectasis. We also want to assess for bronchophony. This test is done by putting your stethoscope up to each lung field and asking your patient to say the number 99. If the 99 sounds faint and muffled, then this is a normal finding. If the 99, however, sounds clear and loud, then this is an abnormal finding, indicating that there could be lung consolidation present. Lungs consolidate when they're filled with some type of fluid, such as mucus or blood. This is often heard in patients with pneumonia as well. We should also assess our patient's level of anxiety. Our patient may not necessarily be tachycardic because of the carbon monoxide poisoning. It could be that they're having anxiety about what's happening to them. And lastly, patient teaching, which we'll be going over next in detail. By the way, guys, remember that nursing interventions and care plans should always be specific to your patient and could differ based on the source of carbon monoxide poisoning. So as we just stated, part of your nursing intervention is going to require patient teaching. This could be preventive teaching to prevent your well patient from being exposed to carbon monoxide, or discharge teaching to make sure that your patient that has been exposed to carbon monoxide is safe when they go back home. So we're going to go over some safety guidelines for carbon monoxide just in case it pops up on an exam. These tips may also be helpful to those of you that are watching. Alright, so tip number 1, install a carbon monoxide detector in every level of the home. It's important to know and learn the difference between the sound of a smoke alarm and the sound of a carbon monoxide alarm. The detector battery should be checked or replaced when clocks are changed each spring and fall, and of course as needed. If the carbon monoxide detector alarms, leave the home immediately and call 911. Smoke detectors and carbon monoxide detectors should never be removed. Open fireplace flue for adequate ventilation. Keep vents and chimneys clear of debris and have them checked every season. Furnaces should be professionally inspected each year. Teach your patient that they should never use a gas oven to heat their home. Windows should be opened slightly whenever using a kerosene heater or gas heater. Barbecue grills should never be used in the home or garage. Teach your patient that they should never leave their car running in a garage. Never use a generator, charcoal grill, camp stove, or other gasoline or charcoal burning device inside of the home, garage, or basement, even if the windows are open. And as we stated earlier, carbon monoxide is tasteless, colorless, and odorless. So if you even suspect that carbon monoxide may be in your home, please be sure to call the fire department right away. Even if it turns out to be no carbon monoxide detected, it's okay. It's better to be safe than sorry. Alright everyone, that brings this video to an end. Please be sure to like, comment, share, and subscribe. Remember to never give up, and as always, thanks for watching.